As Montanans spend the next few weeks following the stay-at-home order, healthcare providers say it'll be particularly important to take care of your mental health. MTN's Jonathan Ambarian talked to two Helena organizations to get their advice.
Health professionals say the major changes brought by coronavirus will put a lot of pressure on many Montana families.
Social isolation and distancing is often a huge stressor for people who already are experiencing anxiety or depression or trauma.
The effect may be particularly strong for children and teens.
I think for young children, probably the biggest stress is the disruption in routine. For adolescents, being isolated from their social group is incredibly stressful. I think as adults, we need to not minimize that.
Organizations say they're taking steps to make sure they're available to help if people call. Leaders at Intermountain increased their capacity to provide teletherapy.
Now that we're settling and struggling with staying in place, we're finding that it's hard for people to reach out, not knowing if they should go out. So it's even more important that we expanded our services so that we have more teletherapy.
Chaudere Children's Hospital is still admitting some patients, but they shifted much of their effort toward doing outpatient therapy remotely.
Actually, because we have reduced our bed capacity on the inpatient side, we now have more capacity for psychiatrists, nurse practitioners, and therapists.
Leaders say things like keeping a consistent routine can help, especially if children are struggling. But one of the most important things is simply to ask for support if you need it.
Don't try to tough it out, call for help.
In Helena, Jonathan Ambarian, MTN News.